Good day. My name is Alia Qureshi. I'm a general and minimally invasive surgeon at Beth Israel Lahey at Harvard Medical School. I would like to thank Doctors Matthew Goldblatt and Lena Kaitan for the program chairs for allowing me to present here today, as well as Dr. Jeffrey Marks, session chair, for the opportunity to present what elements are needed to set up a Foregut Center, the academic practice perspective. I have no disclosures. So to give you a brief outline of what I'll be talking about in the next 8 or so minutes, we'll be talking about the importance of having a vision for your Foregut Center, the importance of communication and collaboration, and along with that, credentialing and the impact that that has, in particular on an academic setting. And we'll also speak about a Foregut pathway, whether the single surgeon approach or a clinical Foregut-centered approach. So to start off, the vision that you have for your Foregut Center is critical. It's critical to bringing around the elements that will make a creative and collaborative effort with multiple disciplines coming together. And this vision is what's going to drive your ability to pull this together. And as I will speak to you, the elements that make up a Foregut Center are somewhat challenging. It can be complex, and it will take perseverance. So the vision of your program center will have to have certain elements to make it successful. And in this vision, you'll need to think about the disease processes. For example, will you have esophageal, benign, or malignant? Gastric, esophageal as well, benign or malignant. Will you include bariatrics? Will bariatrics be part of your program, or will they be one of the divisions or one of the disciplines that will be engaged in your program, or not at all, perhaps? You'll also need to be thoughtful about how you will bring all of these disciplines together. Thoracic surgeons, GI, gastroenterologists, general surgeons. And again, you'll be thoughtful, in particular in this day and age, about bariatrics and how they will integrate. Will they be a seamless part of your Foregut Center, or will they be their standalone entity? And then we'll talk also about Foregut Center models, again, the single surgeon versus a more centralized approach. To start off with credentialing. So credentialing ensures safety of both the patients and is also protective of surgeons. The guidelines are put in place to ensure both quality of outcomes and safety outcomes. And this is so that patients receive the highest level of care. We know from past experiences that credentialing can be onerous and complex, and you will need administrative support to get this done. This is not new. Over 1,000 years ago in Persia, physicians had to demonstrate their skills in order to have the privileges of looking after patients, and that makes total sense. This can be a legal matter, and it has significant implications if you don't do this properly. Additionally, as Foregut centers and operators of Foregut centers, we want to think about the mechanisms that are needed to introduce newer technologies, in particular in this day and age. We also want to be thoughtful about credentialing of surgeons. So this is a national conversation that a lot of us are having. What are the issues around training? What qualifies a Foregut surgeon? Do they have to be fellowship trained? We know that many general surgeons are doing Foregut procedures and they're doing them well. Well, what are the characteristics that define a Foregut surgeon then? And while we don't yet have the answers, we do have some papers and some physician papers on these issues. Many of them speak about volume-driven outcomes, meaning that those surgeons that have more experience are doing greater volume in a more regular fashion, have better outcomes. And the volume can range from 10 per year to 50 per year, so there's quite a range as well. One of these other societies has put out a position paper stating the qualities imperative in a Foregut surgeon. They include understanding the physiology of the Foregut in both health and disease, the ability to do a thorough preoperative evaluation of their patients, applying their expertise and training in benign Foregut disease, and to selectively apply the appropriate treatment based on a patient's physiology and psychology in in achieving the best potential outcome. Additionally, foregut surgeons should have long-term follow-up of their own clinical outcomes, as well as quality of life in terms of how their patients are doing post-operatively. Finally, and perhaps most importantly, foregut surgeons should have the ability to have insight to when they've reached or they have cases that are beyond their scope of training, and to have collaborative ability to get the patient the care that they definitely need. So credentialing is definitely an important component of foregut centers, as is communication and collaboration. You need to be able to engage your leadership in the creation of a foregut center. To do this, in part, you will need to submit a proposal, and that'll be the nuts and bolts of what your foregut is about. And some of that we've already spoken to earlier in this talk. We spoke about the elements that will create that will be central to your proposal. And those are also going to be needed with laying out of the administrative help that you're without doubt going to need. You're also going to need to discuss in your proposal the issues of territory. Much better to lay this out right from the beginning, and to avoid territorial conflicts and to obviate the need for confrontation by laying out a platform and a mechanism to have open and honest engagement between the different specialties that we discussed before. You will hopefully not have many conflicts between the different disciplines, although in particular, again, in an academic setting, the potential there is significant. Additionally, you'll want to have a mechanism, as stated before, for the integration, and this will be part of your proposal, to have the integration of technologies such as POEM, LINX, Strata, and whatever else might be coming out there. And there are many others that I've not listed. And you'll need resources, both in terms of finances as well as people power, in terms of needing the resources to get the Foregut Center to become a success. You'll also want to engage your team, and I've already spoken to the importance of engaging in an open and collaborative and creative way your thoracic surgeons, your GI specialists, as well as general surgeons. One potential mechanism is to have journal clubs on a regular basis. There's also the opportunity to have GI, general surgery, thoracic rounds with regards to presenting the data of complex cases, as well as having an open mortality and morbidity conference, so that it lays the opportunity for others to learn as you move forward. Along with that, you want to be thoughtful about creating opportunities for training, both for fellows and residents. To do this, to create a successful Foregut program, in particular at an academic center, you want to push, and you'll need to get out of your comfort zone to do this. As surgeons, we are born with grit. We can take this on. And when you get out of your comfort zone, that's where the magic happens. And that's how you create a successful Foregut Center, by being thoughtful, persevering, and having some grit. When you have the elements of your Foregut Center, then you also want to start to think about the model, the Foregut model that you're going to follow. Are you going to have a single surgeon model where you have referrals that come in and you take care of it? Obviously, there's some limiting components to that. Or there are also hybrid models that use kind of a centralized, but not really. It's actually independent surgeons working together. Or do you aim for a truly Foregut-centered, centralized pathway? To me, the centralized pathway makes the most sense. However, is there any data to support this? A group of surgeons in the UK actually went about conducting a study. They created a centralized Foregut pathway and program through some of the elements that I presented earlier in this talk. And then they actually studied it. From 2010 to 2014, they created and maintained a database, a prospective database, looking at their referral patterns and operative cases as a result of this, creating this. And this data was then cross-referenced with hospital coding data. The results were actually very positive. They demonstrated a sustained rise in new referrals that led to operative cases. They also increased the number and type of physiological studies that were initially a part of their Foregut, their ancillary studies that were part of their Foregut Center. And the trend was also upward towards the new technology. In this case, they had introduced the LINX, or magnetic sphincter augmentation. So this is the actual data, just demonstrating. On the bottom, you can see the months and the year. And on the left side, you can see the number of cases, 10, 20, 30, 40. And there is linear increase with regards to anti-reflux referrals over time. A steady climb of referrals, and this also related to steady climb of studies, such as wireless pH and high-resolution endosophageal manometry. And this also, intuitively, you would think this would translate into cases, and it did, for fundoplications, total anti-reflux procedures, and the links that they were using, that was their new technology, all increased. Interestingly, though, the paraesophageal hernias did not increase, and this may be, in fact, related to the fact that paraesophageals present in an emergent fashion. So with that, I would like to summarize that in the last few minutes we've discussed the elements that are needed for a Foregut Center from an academic perspective. We've spoken about the importance of having a vision of your Foregut Center, the importance of communication and collaboration, and credentialing, and how important that is, in particular in the academic setting. And we've also spoken about a centralized Foregut pathway. And with that, I hope that I've conveyed to you the elements of an academic Foregut Center that are necessary for it to be successful. Thank you very much.